It's a common misconception that cerebral palsy, or CP for short, is a single condition. Actually, it's a group of neurological disorders that target a person's mobility and their ability to maintain normal posture and balance. There's no cure for CP, and it tends to be a lifelong condition, although its severity can range from mild to severe. The U.S. Centers for Disease Control and Prevention, more commonly referred to as the CDC, states that cerebral palsy is the most common motor disability affecting children, impacting 1 in every 345 children. According to the Cerebral Palsy Foundation, 17 million people across the world have cerebral palsy, and 50% of them live with chronic pain. Generally speaking, cerebral palsy is caused by brain damage or abnormal brain development. 90% of all CP cases occur before birth or during delivery, which is classified as congenital cerebral palsy. The remaining percentage occurs 28 days or more after birth, categorized as acquired cerebral palsy. According to the CDC, congenital cerebral palsy accounts for the vast majority of all CP conditions, between 85% to 90%. While doctors do not know the specific cause of most congenital forms of CP, some children may be at a higher risk for developing congenital CP than others. Risk factors to consider include low birth weight, which applies to infants born weighing under 5.5 pounds, premature birth of children born before the 37th week of pregnancy. Multiple births, including twins, triplets, and higher counts, are also at a higher risk for developing CP. Some types of infection during pregnancy can increase the risk, such as rubella, chickenpox, cytomegalovirus, and bacterial infections. The mother having a fever during pregnancy or delivery is a key indication of an infection that could put a baby at risk. Asphyxia, or a lack of oxygen, may also lead to CP. This can occur if the umbilical cord wraps around the child's airway or if there is a rupture or detachment of the placenta. There is an increased risk of CP development in children conceived through in vitro fertilization or other infertility treatments. In some births, misuse of forceps or vacuums to help with the delivery process may result in delivery complications and head trauma. Genetics may also be a factor in cases where there is no other clear cause of cerebral palsy. If there is a history of CP in the family, there may be an increased chance of CP developing in a child. Acquired cerebral palsy is the second type of CP, occurring due to brain damage that happens more than 28 days after the child's birth. Often associated with infection or a head injury, this category of CP becomes noticeable later in the child's development. It's not easy to pinpoint the cause of all cases of acquired cerebral palsy, but common causes include infections that impact the brain, such as meningitis and encephalitis. Any direct head injury may cause brain damage, leading to the development of cerebral palsy. Common causes of head injuries include car accidents, significant falls, and child abuse. Lack of oxygen, known as asphyxia, may also be a cause of acquired CP. This may occur in any situation where there is a lack of oxygen-rich blood flow to the brain, such as cerebrovascular accidents including strokes, heart defects, or blood vessel damage. Unfortunately, as with congenital development, knowing what caused the onset of acquired CP is not always possible. Since approximately 90% of all cerebral palsy cases occur before birth or during delivery, it's important to pay close attention to when symptoms of cerebral palsy first occur, which will provide valuable insight into the cause of the condition. Consider the 4 main types of cerebral palsy. According to the CDC, about 80% of people who have spastic cerebral palsy with increased stiff muscle tone that makes their movement challenging or awkward. Those with dyskinetic cerebral palsy may have trouble moving their hands, arms, legs, or feet, which makes walking and sitting difficult. A person with ataxic cerebral palsy has trouble with coordination and balance, which makes them unsteady when trying to walk and can cause difficulty with quick movements or tasks like writing. Finally, mixed cerebral palsy may give a child symptoms of several other forms. Since most cases of CP are congenital, there may be a few things pregnant women can do to reduce the risk, such as taking steps to protect their health, getting vaccines for certain conditions that could harm the child, and getting treatment for any serious infection. Women at risk for preterm delivery should work closely with their doctor to stay as healthy as possible. Minimizing birth complications may include frequent prenatal visits and screenings, plus seeking out medical assistance when necessary. Remember, it's not possible to diagnose cerebral palsy without fully understanding what happened to your child before, during, and in the months following birth. That's why it's essential to monitor your child's development over time to look for any indications of CP. A proper diagnosis is critical to protecting your child's future. You can find abundant resources to help you learn more about causes of cerebral palsy, treatments, family forums, parent support groups, and more at birthinjurycenter.org.